Assalamualaikum and hi everyone. Welcome back to PHC 562. So finally, this is the last lecture for this course, and today we will cover the clinical applications of drugs affecting central nervous system, particularly on the pharmacotherapeutic management of psychiatric disorders. As usual, this is the learning objective for this week lecture. So at the end of this lecture, you should be able to integrate the pharmacological knowledge of drugs into the clinical practice, discuss the pharmacotherapeutic management of psychiatric disorder based on the clinical practice guideline. In this lecture, I will highlight on the APA guideline as well as our Ministry of Health guideline, MOH. And you should be able to identify the possible and actual drug-related problem, DRP, in the management of psychiatric disorder. Let's recap back what you have learned previously in this course. You have been introduced of various pharmacological classes of drugs that used to treat neurological disorders such as epilepsy, Alzheimer's disease, and Parkinson's disease, as well as psychiatric disorders such as insomnia, anxiety, depression, bipolar disorder, as well as schizophrenia. Besides that, anesthetic, painkiller, and substance that may lead to abuse also been covered in this course. As you can see in this graph, shown that Malaysia is the highest prevalence of depressive disorders among Asian countries in the year of 2017. And now it can be worsened due to the current scenario of pandemic COVID-19 that affects worldwide. So today's lecture, I will discuss the clinical application of drugs that used in psychiatric disorders, especially for the treatment of schizophrenia as well as the depressions. This table shows the summary of pharmacological classes of drugs that used in treating of psychiatric disorders. As you can see here, benzodiazepine. This benzodiazepine group of drugs are used for the first-line agent in treating insomnia as well as anxiety. This group of drugs also can be used as adjunct therapy for schizophrenic patients who develop akathisia due to these antipsychotic drugs, or it also can be used in major depressive disorder patients who develop either anxiety, insomnia, or show any agitation of it. Besides that, benzodiazepine also can be used in adjunct therapy in acute mania in bipolar disorders. Bear in mind that the use of this drug are for the short-term treatment only, which is about 2 to 4 weeks to avoid the risk of drug dependence. Antipsychotics is used for first-line agent in schizophrenic patients, except for clozapine, which we'll discuss later in the next video. Antipsychotic also can be used as first-line agent in bipolar disorder as well as to treat major depressive disorder with psychotic features. Antidepressant drugs such as SSRI, bupropion also can be used as adjunct therapy in acute bipolar depressions. Lithium, valproate, and carbamazepine are the gold standard, which act as mood stabilizer in treating the bipolar disorders. Before we go further on the clinical applications of this drug, I would like to introduce you on the pharmaceutical care. As a pharmacist, our roles have been evolved from the product-oriented such as dispensing of medications to more patient-focused services, or also known as pharmaceutical care. In this pharmaceutical care, we need to collaborate with the doctors, patients and their family members, as well as other member healthcare in designing, implementing and monitoring a therapeutic plan that will produce desired specific outcomes. In this pharmaceutical care, we need to identify any drug-related problems, or known as DRP, or any pharmaceutical care issues and give resolution or do some preventions. Drug-related problem, or known as DRP, are defined as problem in the pharmacotherapy of the individual patients that actually or potentially interfere with desired health outcomes. In this slide shows the among the most common DRPs, which are the adverse drug reaction, drug choice problem, dosing problems, drug use problems, and drug-drug interactions. In the central nervous system drug, akathisia, weight gain, tardive dyskinesia, QT prolongations are the most common side effects due to drugs that affecting this central nervous system. Here, our role as a pharmacist, we need to be able to identify potential or actual of this DRP so that necessary action can be done, such as counseling, educating the patients, and also their family members on the purpose of this medication being prescribed, as well as the side effect medication to clear their doubt and misconception about the drugs that they've taken. And this will lead to better understanding and better medication adherence. Here, in these sessions, we need to actively collaborate with the doctors to provide the best treatment to the patients according to their health profile as well as their health conditions, especially to avoid any potential of drug interactions which may lead to insufficient response or treatment failure. Here, as a pharmacist, we can act as a safety net to prevent or minimize any potential medication error. SOAP as well as PWDT that we'll discuss after this are the format of documentation that used in our practice. I will not discuss in depth of this documentation, which you will cover more on your during your pharmaceutical care courses in your semester 6. This documentation is crucial as a key for successful communication between clinical pharmacists, as well as provides permanent record of patients that encounter, as well as evidence of our actions too. So SOAP stands for subjective, O for objective, assessments, as well as the plan. And meanwhile, PWDT is acronym for Pharmacist Workup of Drug Therapy, or also known as CP2 in the government hospital setting. Alright, let's have a break. In the next video, we will discuss this case as well as management of schizophrenia based on the Malaysian Clinical Practice Guideline, as well as the latest edition of American Psychiatric Association Guideline 2019.